Welcome to Anti-Aging Insights, where age is a state of mind and aging is a treatable condition. And now, here is your host, Dr. Teri Fisher.
Hello, and welcome to this episode of the Anti-Aging Insights podcast. I just want to thank everybody for all the great feedback that we have been receiving for the podcast. It's really appreciated, and we're having a lot of fun producing these episodes for you. Today, we have a special guest, Skye Lintott, who is the Western Canada Sales Manager for Crysvita. We get to talk about NCTF. And what is NCTF, you might be wondering? Well, it stands for New Cellular Treatment Factor. I'm really excited to learn a lot and also have a chance to have all of you listeners learn a little bit from her as well. So, Skye, first of all, welcome to the podcast.
Thank you so much for having me, Dr. Fisher. It's exciting and fun, and I'm so glad to be a part of it. I love listening to them too, so I can't wait to hear the rest of the ones that you have coming.
Thanks so much. It's great to have you here, and NCTF is a very, very popular product, and we're going to get into all of that and explain a little bit about what it is and how it all works. But amazing. Perhaps before we even get there, maybe I can just ask you to give a short introduction to you, who you are, who you work for, your position, and that sort of thing for the listeners.
For sure. Well, I've been in this space for a very long time. I don't want to say how long because it will really date me, but I think we're going on probably close to 20 years. I've done everything in the industry from various sales positions to running and managing clinics, just assisting different plastic surgeons. Back in the day, I used to inject. So I've really been around and seen a lot of different things. My current position right now is with a company called Crysvita, and their head office is in Montreal, but the products that we get are from Filmed, Filorga, people may have known it as, and that is from France. And the production is coming out of Brussels. So some really interesting, innovative products that we have.
Fantastic. All right, so let's get right into this because the topic of this really is NCTF. So let's start right from the beginning. For those that have never heard of this before, what is NCTF? What does it stand for? What is it? What's all the good stuff about that product?
Good question. So NCTF is New Cellular Treatment Factor. It's a mouthful. But what it is, and a lot of your patients will know NCTF because it's been around for 40 years. It's in 70 countries. It's been known as the Chanel shot, the glass skin therapy. Still this day, the number one skin texture treatment in Korea, France, and many other parts of the world. So it's widely used and known because it works, honestly. And I think that's what's given its longevity because patients get the treatment and they come back wanting it more. I think because it's instant gratification, you get it, and then also long-term gratification. But it's one of those treatments where right away you get off the bed and you're like, wow, okay, I see a significant difference in my skin. So it's something that's been around a really long time, and we're very lucky now to finally have it in Canada. Something that it is a medical grade product, so you have to be a physician to carry this product. So we had to do all our own clinical studies, as well as all the studies that are out there around the world for other countries that have it. We had our own clinical studies done for Canada that were very, very impressive with some pretty big KOLs, and we love it. It's doing and ginormously well because as soon as patients, like I said, they can get it done with microneedling or after a laser treatment, and they really see the change in the skin right from the get-go.
That's great. So tell us a little bit more about what it does. You mentioned a couple things there, like you can get it with microneedling or after a laser treatment. Why would someone want to get it, and what does it do for their skin?
So it's perfect because it's full of coenzymes, vitamins, minerals. It has something called nucleic acid, which is really good for healing, and it has glutathione. There's so many, I could go on and on about all the different ingredients. When we did our clinicals, we have 256% of collagen stimulation, 148 production of fibroblast stimulation, 90% free radical. So for you and a lot of your viewers, I'm sure, are very technical. They like to get into that. It just shows that there's an environment for your own cells to renew themselves, to come back stronger and healthier. And that's what we want to see. So that's what we're doing. When we do something with microneedling, we're creating little channels within the skin. So the skin is very open and ready to take in whatever you're going to give it. So we're giving it hyaluronic acid, which we all know is amazing for the skin. It kind of nourishes you and gives you lots of hydration right away. And that's what gives us that glass skin. It covers all those fine lines and wrinkles and pores, but then also all those vitamins and minerals and all those nutrients that we need get into the skin. Skin is the biggest organ. It needs all those things. So we're able to give it like a real good IV shot. And then everyone's going to be a little bit different. My skin might take in something that's different for your skin. The protocol is they come for 3 treatments. However often they're doing their microneedling or their laser treatment, they would have NCTF right afterwards. And first of all, they're going to see the skin is going to be glowing, beautiful, hydrated. Also, their healing time is cut down significantly because of all of these other factors, especially the glutathione. It really helps with the healing of getting any of these more aggressive, say it's a CO2 or any kind of that's really ablative. It really helps with that healing time for the patients. So they're able to go back to work right away. They're not super red or peeling. So it makes a big difference.
Fantastic. And so one of the ingredients you mentioned was hyaluronic acid. And I think that some of our listeners will be aware that hyaluronic acid is also used in dermal fillers, cheek fillers, lip fillers, etc. So can you perhaps distinguish for us the differences there and why you would use NCTF?
For sure. Hyaluronic acid can be administered a few different ways. When you're thinking of filler, that's typically a cross-linked hyaluronic acid. So it's a little bit thicker, can dance there's different G primes that allow us to go into different areas of the face. This hyaluronic that we're using for NCTF is uncross-linked, which means that it's really just going to go in and provide that hydration all over. It's not just staying in one therapy. It's not for volume. It's not for one area. It's to give hydration really from the inside out all over. That's as easy as I could try to make it without getting super clinical.
That's great. That's great. And then you touched on this a little bit, but maybe you can clarify a little bit more. How often do you recommend that patients get treatments with NCTF? And then how long would that treatment last? How long would you recommend that they go before getting another treatment after that?
You know what? Everyone's skin is different. And we have protocols where we want 3 for sure to see that optimal treatment, because the skin goes through a skin cycle, typically 28 days. If you're a little bit younger, a little bit more, if you're getting a little bit older, to go through a full skin cycle to get that sloughing and new cells come up. So we want to be touching those cells as they're going through that process. So they come day 1, day 15, day 30. At that time, we're really going to see how the skin has been affected by these ingredients. And then you might say, wow, okay, the skin's looking amazing. It's at its optimal. We want to have you on some really good skincare. Come back in 3 months. Or you might say, you know what? I'm seeing some pigmentation still. I'm still seeing some rosacea. We haven't got all the fine lines and wrinkles. Maybe you need to come back in another 15 days. Let's get you to that beautiful place where we know your skin can be. And then we just can do some maintenance. So everyone's a little different. Typically, though, we do it on how often you would be doing your laser therapy or your microneedling therapy. So the technician or the doctor obviously is going to know that better. So whatever kind of treatment protocol you're putting your patients on, you would administer that and then just always put the NCTF on right after.
And is that the most common way that patients are doing it? They're doing it in conjunction with some other treatment? Or do patients come in specifically just saying, look, I just want NCTF with nothing else?
We have to create a channel. So creating a channel is we have to create little micro tears in the skin. So they can go buy it or have it however it is, but if they just put it on their skin, it's not going to do anything. It has to be administered with that little micro channel. So they can dermal roll it. There's lots of ways to get that effect, but we need that. And really want to do that in a medical setting because we're opening the skin, right? So we want to make sure that we're being very careful with all of that.
What about side effects or downtime from NCTF? What do you typically tell patients about that?
No downtime. It's actually the opposite of that. We use it to take away the downtime because in a lot of our clinicals, we use something called a Visia machine, which shows us inflammation internally. It significantly takes down inflammation, significantly. So people that are really inflamed internally from like say rosacea or acne or just to have more sensitized skin, it really helps. That nucleic acid really brings down that inflammation. If anything, it's just going to help soothe and ease and strengthen the skin. We know with anything, like we always say with pregnancy, autoimmune, those types of things, like they have to speak to their doctor. But really, if it's something that if you wouldn't do microneedling or laser on that patient, then you probably wouldn't use NCTF on that patient. So we try to stick with what that protocol would be with the physician.
Great, great. And so one of the things that I'm always interested as a physician, and I'm going to assume that some of our listeners out there are interested in this as well, is the evidence behind this stuff and
Yeah.
studies.
I love that you asked that. Thank you.
Please go ahead. Tell us about it,
Well,
because I'm interested.
because you know what? Like I said, I've been doing this thing for a while, and I've seen a lot of products come and go and a lot of fads come and go. And honestly, at the end of the day, you have to look at the clinicals. And I think that physicians really appreciate that. They look at a white paper, they look at a clinical, because those aren't going to lie, right? That's the science. That's really showing us what is this doing on a cellular level? What is this when we're testing it and using stains and all of those types of things? We can really see how is it affecting the skin. We have so many clinicals because it's been all around the world. So we have clinicals from all over the world. If you go to fillmed.com, FILLMED.com, or if you go to NCTF, you'll see all the clinicals and white paper that's there. And we have our own clinicals that we did for Health Canada. But there's tons of research that will show exactly what it does and back up what we say. So it's not just we're telling this lovely story. We have a ton of evidence to show it. And that's why I think, again, it's been popular and stays popular for so long.
That's great. And that's so important to me. Like I said, as a physician, and like you said, as many physicians, that's what we want to practice, evidence-based care. And so it's great to hear that those studies are there. And what I'll do is I'll have to share the link to the studies as well, I think, with our audience so that they can have a look at that if they want to see that.
Good late night reading for sure.
Yeah. So you said this is relatively new in Canada now. How long has it been in Canada?
It's been in Canada for about a year, but we just really started getting a sales team out there, to be honest, because we were going in, we do something where we give these products to KOLs, our key opinion leaders, and ask them to try and use it with their patients and before and afters. So we did that with FillMed, which is our filler that's also from the same company called Art Filler. So now that we've done that, we've seen it, they've got their hands wet with it, they're using it, and now we have a sales force that's really out there providing it to the doctor's offices. So you're starting to see it more and more.
And I can say that we're really pleased to have that at Anti-Aging, and it's wonderful to be able to have the product.
Well, you know what? I know Dr. Frame only wants the best. And Nadine, they want the best. They want to be the first. They do all their research before they bring anything in. So it's great for me too. Like, I'm glad to be part of that because they're going to have really good results. But I think also their patients have that faith and trust in them that they're going to be always going to have the best products. That's
great. If people want to learn more about it, where can they go? Of course, other than Anti-Aging, Laser Medical Clinic, have come to our clinic.
Yeah.
But are there other resources or places that you can suggest that they go where they can just learn a little bit or read up about it?
Absolutely. So if they go to fillmed.com, so FILLMED.com, which is the website, so it has everything there. But honestly, if you go into any social media and just hashtag NCTF, it's just a wealth of information on YouTube, doctors from all over the world holding their little red box, talking about it, showing results before and afters. There's tons of information. One thing that's interesting is that, because it is so popular, people try to knock it off. So there's a little QR code on the boxes. So if the patient comes in, they can actually ask to scan your QR code so they can see it's the real thing that they're seeing. The real product, yeah, because it really is. It's like people are trying to knock off Chanel. They're trying to knock off our NCTF, and so that QR code really shows that it's the real product. But there's a lot of information, social media, or of course directly onto fillmed.com, or Cressita.com also has all the information.
Perfect. Well, one more fun question that I'd like to ask people on the podcast is, we're called the Anti-Aging Insights, and I'd love to get your take on just what does the term anti-aging mean to you?
Anti-aging, I'm kind of like pro-aging.
Yeah, and that's great. That's great.
Yeah, I think that really it's about being the best you.
Yeah.
I really think people have gone through that. They don't want to look that they're 20 or 20, that's not what they're trying to do. They want to be the best selves. And that's internally and externally, right? We want to be healthy. We want to live long, vibrant, healthy lives. And we want the outside to complement or to marry how we're feeling on the inside. And that's what I think when I'm looking at a patient, how can we best do that? We're not going to take 20 years off, but I want to make you have beautiful, hydrated, juicy skin. I want to give you some of that youth glow. I want to take away some of that tired look internally and externally. So I think that's it, just looking the best for your age.
Wonderful. Well, Skye, hey, it's really been a pleasure chatting with you. Thank you so much for taking the time. It's been great. And You've given us a couple of links. I'll make sure that we can share those out with our audience as well. And I look forward to chatting with you more and seeing you around the clinic in the coming weeks and months.
I will be there. I want that new machine, the CO2. I'm coming in for that one.
All right. Perfect. And then we'll add some NCTF on top of that, right?
Perfect.
All right. It's been a pleasure, Skye. Thanks so much.
Okay, bye.
Well, I hope you enjoyed that interview with Skye. Of course, if you are interested in getting an NCTF treatment or multiple treatments, as Skye mentioned, of course, please feel free to reach out to us at Anti-Aging Laser and Medical Clinic in Vancouver. We would be only too delighted to help you out and guide you through that process. As usual, thank you again for tuning in to the podcast. We are now on multiple podcast players. Initially, we were on Spotify, and now we are on Apple Podcasts and Google Podcasts. And of course, if you are enjoying this, please feel free to share this, and a rating and a review, an honest review, would be most appreciated, and it would help us to get this message out to other people that may benefit from this content. As always, it's been a pleasure chatting with you this week, and I look forward to chatting with you again next week. Take care, and talk to you soon.
Thanks for listening to today's episode of Anti-Aging Insights. Stay tuned to discover more of the latest news, treatments, technologies, and developments in non-surgical cosmetic and anti-aging medicine. For more inspiration, to access the show notes, or to book an appointment with Dr. Fisher, Dr. Frame, or any of the other anti-aging professionals, please visit our website at antiagingvancouver.com. Until next time, stay inspired and live life well.